I want to talk to you a little bit about self-compassion. Self-compassion is not self-care. It's a part of self-care, and I really believe it's the first step in self-care. But we can't have self-care unless we really are compassionate toward ourselves. Now, we physicians, we're naturally compassionate people. I don't think we would be drawn toward medicine, especially primary care, unless we were compassionate people. And many of us like to combine that natural compassion that we have with our skills that we learn, the science, medical part of medicine, to care for patients. So, if you think about the compassion that you have for some of your favorite patients, or even some of those patients that are the most difficult. When you walk into an exam room and you see someone who is in pain, or is in suffering in some way, your heart goes out to that person. And very often you recognize pretty quickly when somebody's in pain. You recognize that this is something that is fairly common. It's one of the most common things that you encounter as a physician. And you also can show that you really want to help that person, that you not only want to help, but you really care for them. You want to nurture them in some way. And of course, you want to help them in some way to try to make that suffering go away. But you can't always do it. And we don't always have the magic answer for many of the complaints that people come to us with. But when it comes to turning that same compassion we have for other people toward ourselves, we often fall short. I say we because I count myself among all of us when that comes. Part of that's this misconception that we've been programmed to believe through medical school, that it's a sign of weakness to feel sorry for ourselves, or we're not real doctors unless we can just put away our emotions and our feelings and just keep taking care of our patients selflessly. Well, it turns out to be the exact opposite. The more that we show compassion toward ourselves, the more compassionate we are toward other people, the better doctors we are, and the better our own mental health and physical health turns out to be. So, self-compassion, what is it? Number one, 3 components. Number one is the ability to recognize that we are suffering. The ability to be able to say, wow, this is difficult for me. This whole pandemic thing, and trying to figure out what to do with my kids and be at work and deal with these layoffs or salary cuts or whatever it is. This is difficult. This is hard. Second part is to recognize that we are part of a community of people, humanity, that suffers, that's going through this also. Some people want to make us out to be superheroes on a pedestal, but we're not. We actually function much better when we find ourselves as part of that community, that common humanity. Number 3 is self-kindness. Self-kindness, being able to turn that nurturing that we usually have toward our patients toward ourselves. So, number 1, recognizing that we are suffering. Number 2 is realizing that this is part of our common humanity. Everyone suffers. Sometimes we can do something about it, sometimes we can't. Number 3 is we may not have the answer to make it go away, but maybe we can do something to take care of ourselves in the moment. Just to be kind to ourselves in the moment. So these 3 practices help us to be compassionate toward ourselves the same way that we are compassionate toward our patients. So try to practice some self-compassion. And you can use the audio exercise that is also included with this video.